As the summer sun begins to fade and leaves start to turn, a silent threat emerges from the shadows. It's a threat so small it can be hard to see, yet it carries the potential to cause serious illness. We're talking about mosquitoes, and more specifically, the diseases they can carry, like Eastern Equine Encephalitis, or EEE. EEE is a rare but serious illness that affects the brain. It's primarily spread through the bite of an infected mosquito. While cases are not as common as other mosquito-borne illnesses, the severity of EEE makes it a critical public health concern. This year, there have been confirmed cases of EE in several states, including Massachusetts and New Hampshire, raising concerns among residents and health officials alike. Understanding the risks associated with EEE and taking the necessary precautions is crucial for everyone, especially during peak mosquito season. In this essay, we'll delve deeper into what EEE is, how it spreads, and most importantly, how you can protect yourself and your loved ones from this silent threat. Eastern Equine Encephalitis, or EEE as it's commonly known, is a rare but serious disease that causes inflammation of the brain, also known as encephalitis. This inflammation can lead to a range of neurological problems, some of which can be life-threatening. The virus that causes EEE is primarily found in birds. Mosquitoes that feed on infected birds can then transmit the virus to humans and other animals, including horses. It's important to note that EE cannot be spread from person to person or from animals to humans, only through the bite of an infected mosquito. EEE can affect people of all ages, but those who are very young or very old, as well as individuals with weakened immune systems, are at a higher risk of developing severe complications from the disease. While there is no specific treatment for EE, early diagnosis and supportive care can improve outcomes for those infected. In recent years, Massachusetts has seen an uptick in EEE cases, prompting concern from public health officials and residents alike. The state's Department of Public Health has issued advisories and warnings urging people to take precautions against mosquito bites. The geographic distribution of EEE risk within the state can vary. Areas with freshwater swamps and marshes tend to have a higher concentration of mosquitoes that can carry the virus. Additionally, factors such as rainfall, temperature, and mosquito control efforts can influence the risk of EEE transmission in a particular area. The Massachusetts Department of Public Health provides regular updates on EEE activity in the state, including information on confirmed human and animal cases, as well as risk levels for different regions. Staying informed about the latest developments is crucial for residents to make informed decisions about their health and safety. EE is primarily spread through the bite of an infected mosquito. These mosquitoes become infected when they feed on the blood of infected birds, which are the natural hosts of the EEE virus. Once a mosquito is infected, it can then transmit the virus to humans, horses, and other mammals through its bite. It is important to emphasize that EEE is not contagious and cannot spread directly from person to person or from animals to humans. The only way to contract EE is through the bite of an infected mosquito. Mosquitoes that transmit EEE are most active during dusk and dawn hours, but they can also bite during the day, especially in shady areas or during cooler temperatures. These mosquitoes breed in standing water, so it's crucial to eliminate any potential breeding grounds around your home. Section 5. Recognizing the symptoms. Recognizing the symptoms of EE is crucial for early diagnosis and treatment. The disease often presents in two distinct phases: an initial flu-like illness followed by a more serious neurological phase in some cases. The initial symptoms of EEE typically appear 4 to 10 days after being bitten by an infected mosquito. These symptoms can be easily mistaken for other common illnesses and may include high fever, chills, headache, muscle aches, and joint pain. In some cases, the initial symptoms of EEE progress to a more severe neurological phase, which can involve severe headache, stiff neck, disorientation, seizures, and even coma. If you or someone you know experiences any of these symptoms, especially after a mosquito bite, it's crucial to seek immediate medical attention. Section 6. Assessing the risk in your backyard. While EE is a serious disease, it's important to remember that it is relatively rare. However, understanding your risk and taking the necessary precautions can significantly reduce your chances of contracting the virus. Several factors can influence your risk of EEE, including geographic location. As mentioned earlier, certain areas, particularly those with freshwater swamps and marshes, tend to have a higher concentration of mosquitoes that can carry EEE. Time of year. Mosquitoes are most active during the warmer months, typically from late spring to early fall, which is considered peak mosquito season. Outdoor activities, spending time outdoors, especially during dusk and dawn hours when mosquitoes are most active, increases your exposure to potential bites. By being aware of these risk factors and taking appropriate precautions, you can enjoy the outdoors while minimizing your chances of encountering EEE carrying mosquitoes. Section 7. Protecting yourself and your loved ones. The best way to prevent EEE is to avoid mosquito bites. Here are some practical tips to protect yourself and your family. Use insect repellent. Apply EPA-registered insect repellents containing DEET, picaridin, or oil of lemon eucalyptus to exposed skin and clothing. Wear protective clothing. When outdoors, especially during peak mosquito hours, wear long-sleeved shirts, long pants, socks, and shoes. Eliminate standing water. Mosquitoes breed in standing water. Remove any sources of standing water around your home, such as buckets, flower pots, and clogged gutters. Install screens. Make sure windows and doors have tight-fitting screens to prevent mosquitoes from entering your home. Support mosquito control efforts. Local mosquito control programs play a crucial role in reducing mosquito populations. By following these simple but effective measures, you can significantly reduce your risk of EE and other mosquito-borne illnesses. Section 8, EE versus West Nile virus, understanding the difference. EE and West Nile virus, or WNV, are both mosquito-borne illnesses that can cause encephalitis, but there are some key differences between the two. EE is a much rarer disease than WNV, but it is also much more serious. While most people infected with EE experience no symptoms, those who do develop symptoms often experience severe neurological complications. In contrast, most people infected with WNV experience mild or no symptoms, and severe cases are less common. Another key difference is the geographic distribution of the two viruses. EE is primarily found in the eastern United States, while WNV is found throughout. There have been confirmed cases. Despite these differences, both EEE, including WNV, are serious illnesses that can have lasting consequences. Taking precautions to avoid mosquito bites is the best way to protect yourself from both viruses. Section 9. Staying vigilant. Your health is your priority. As we've explored in this essay, EEE is a rare but serious illness that should not be taken lightly. While the risk of contracting the virus is relatively low, understanding the potential consequences and taking the necessary precautions to protect yourself and your loved ones is essential. Remember, mosquito bites are not just a nuisance. They can have serious health implications. By staying informed, taking preventive measures, and being mindful of your surroundings, you can enjoy the outdoors while minimizing your risk of encountering EEE and other mosquito-borne illnesses. Your health is your priority, and taking proactive steps to protect it is always the best course of action.